Back from Caring Medical Center, I am so happy to welcome our next guest to the show. Dr. Ross Hauser is a prolotherapist at Caring Medical Center, and this morning he has brought a very special guest, a prolotherapy patient, Miss Patty Dunning. Good morning.
Good morning, Carly.
Welcome back, doctor, and good morning to you. I'm very excited to hear about your story, which we'll get into in just a second. Of course, we're talking about prolotherapy, and I love that you've brought Patty on this morning because, you know, as we've kind of talked about, she's a great example about how prolotherapy may be able to be an option for people when treating their pain and how it's able to change their quality of life, right, doctor?
Carly, there's a lot of people that just are racked with arthritis. I mean, if you looked at Patty's hands, you'd see, you know, that she's done a lot in her life, and she's just a good example of, you know, you can get prolotherapy in multiple areas, and as we've said before, a degenerated joint, and arthritis just means the joint's degenerated, needs regeneration. The injection technique that regenerates joints is prolotherapy, and I'm a prolotherapist, which is a regenerative medicine specialist.
Yeah, and I know people, the kind of the best way to figure out, okay, is this an option? You know, they like to hear other success stories. They like to hear, is it really working for other people? And I love, Patty, that your story begins with you were actually taking somebody else to his office.
That's right.
You kind of found out about it and thought, huh, let me try and see if this, you know, may be an option for me. And
well, I was just a total mess. And you know, I was having all kinds of problems. And when I watched the progress on how my friend was doing, I thought, I need to do this.
So, and you're kind of, where did you have prolotherapy first? Because you had several whiplash incidents.
Yes, I did. And he did C6 and 7 and T1. That's this area right here.
So that's where you started.
Yes, yes. And 3 days later, I could actually turn my neck better than I had in, I don't know how long.
So that's where it started, was in the back. But then I understand it's worked so well for you, you started trying some other areas that were...
Yes, because I had the numbness in my hand, which I figured was coming from the cervical area. Dr. Hauser treated the elbow also because that also relieves some strain and nerve pressure on my hand.
So, and this just started, by the way. When did you start prolotherapy? Just a few months back of this year?
February.
February of this year.
Yes.
So when you look back at maybe how you were feeling in January to how you're feeling now, tell me a little bit about, you know, kind of the difference.
Well, I would say I'm 95% better.
Wow. Wow, that's got to make you feel good, Dr. Hauser. Tell me a little bit about her case, and maybe I know a lot of people can maybe relate to this as well.
You know, she had a pinched nerve in her neck. You know, a lot of people have pinched nerves. They think they need surgery. What they don't realize is that when you have ligament injury, which are the connectors of the vertebrae, when those are stretched out or injured, the bones move too much. And when the bones hit a nerve, that's when you get the numbness or the pain down the arm. And a good non-surgical treatment for like a pinched nerve or arthritis in the neck is prolotherapy. The other thing I'd like to mention is she has had some knee surgeries, like knee replacements, but when you have pain in the knees, even though you've had a knee replacement, a really good option is to consider getting prolotherapy because, again, the connectors of the bones, the ligaments could be weakened or injured, and that's why the knee swells or the elbow swells. And Patty did really, really well with the prolotherapy, which that's a lot easier treatment than getting your knee replacement out and putting your knee replacement back in.
I can imagine, Patty. I can imagine. Well, Patty, what do you say for those people who are watching this morning? Again, prolotherapy isn't something that you necessarily hear a lot going on, you know, in your general doctor's office and saying, hey, go try this. But something made you want to go ahead and take that step to go in and see him. So what do you have to say to people watching this morning that, you know, is curious about this?
Well, I've talked to many people. I'm secretary at my Sunday school class at McGregor Baptist, and several of them, they're all around my age or younger, and I have told them how much, and they can see
I'm
from
sure,
looking at me how much better that I am.
Yeah.
And I say, go for it.
Yeah, give it a try.
That's
See
right.
if, you know, and again, I love that you're very honest, though, that this may not work for everybody. You know, results are going to be different for everybody as well. But certainly if you are having to face a surgery or something, this is a great option, you know, to consider before you go that route, right, doctor?
The other thing too, Carly, is everybody heals the same way. It doesn't matter if you're 4 years old or you're in your mid-80s, I guess.
Looking
Patty.
fabulous, by the way.
No, she's 85, so I mean, it just shows you, like, you know, just because you're 85, like, why should you be in misery? Like she smiles now.
Amen.
She wasn't smile. She was kind of cranky, to be honest with you, when we first started. But no,
Who would
like,
be,
you know,
though?
like,
It's
you know, and she has a
true.
lot going on. Like, she's active, like she said. She still does volunteer work. She has an extended family that they need their grandma. So it just doesn't make sense to just live in pain just because, oh, I'm 84, 85, you know.
That's
so
so
prolotherapy
true.
is a great option.
Well, as we close here, you know, if someone is interested in saying, okay, I'm ready to find out more, what would you have them do? What's the first
Yeah,
step?
absolutely. Visit our Facebook page, you know, Caring Medical, Friends of
You
Caring
can
Medical.
find more people like Patty that have
And
tried
talk
this.
to them.
and-
Say, hey, I got this condition, that condition. Feel free to email me. Go to our website, caringmedical.com. Email me and visit us, Dr. Special and I, at our office in Fort Myers.
That's great. Well, Patty, so glad to hear that you are doing well. We wish you continued success. And
Thank you
and
so
what do the
much.
grandkids call you, by the way?
They call me Mama.
Mama, I love it. Well, thank you so much for being here, Mama.
I have some great-grandchildren that call me Gigi because
I love
I'm a
it.
great-grandmother.
That's awesome. Thank you both so much for being here. Of course,